Skill Learning in Medicine Series 2, I will explain the technique of continuous suture. First, the principle of suturing. Holding the needle holder. Always use the fingertip of your thumb and your ring finger to hold, and the middle finger assist in opening and closing of the needle holder. And use the index finger along the shaft of needle holder for better precision and control. And the action should come from the wrist joint, that is supination and pronation. And the needle should be grasped at approximately 2/3 of the distance from the tip of the needle. And this needle should pierce the tissue at approximately, this should pierce the tissue perpendicular to its surface. The needle should pierce the tissue perpendicular to its surface, and this needle should be placed equidistant from the incision line, that is 2 to 3 mm from the edge of the wound on both sides, and the depth of penetration should be equal on both sides of incision line or the edge of the wound. And remember never to close the wound under tension. There are two types of continuous sutures. One is a simple continuous suture and locking continuous suture. First, I will explain the technique of simple continuous suture. It is the first suture is a simple interrupted suture, similar to that of a simple interrupted suture. So the beginning of simple continuous suture is similar to the simple interrupted suture, and pull the thread so that you will have a shorter end and a longer end, and for minimum wastage it is better to make the shorter end to the shortest and tie the knot, but never cut it. Okay, so to begin a continuous suture, start with an simple interrupted suture, but never cut it, and then the needle is reinserted in a continuous fashion. The needle is reinserted. Remember to prick it perpendicular to the skin surface, and the suture should pass perpendicular to the incision line. See, it should pass perpendicular to the incision line, never oblique. This is simple continuous suture. Pull it. Don't make the wound under tension. Pull it just for approximation, and then reinsert the needle in a continuous fashion again and again. The advantage is that it's a rapid technique for closure and even distribution of tension over the suture line, and this can be used in swelled up tissue. Okay. The needle should pass perpendicular to the suture line. Okay. The disadvantage of the simple continuous suture is that it should not be used in areas of existing tension. That is number 1. And 2, it's not possible to free a few sutures at a time. And when one suture breaks, it affects the whole closure. These 3 are the disadvantages. And you can continue in this fashion, and the suture is ended by passing a square knot over the untightened end of the suture. Ending is by putting a square knot. Take the last suture, pull it so that again you will have a looped shorter end and a longer end, tight. This is simple continuous suture. Don't close under tension. Just approximation of the skin edges is needed. Cut the end. And this is simple technique of simple continuous suture. Now I will show you the technique of locking continuous suture. Here also at first a single interrupted suture is used to make a tie. Simple interrupted suture. Make a tie. Don't cut it, but reinsert the needle through the underlying surface of the flap. Okay. Next, as I already told, insert the needle through the underlying surface of the flap and then pass through the remaining loop of the suture. And the suture is pulled, thus locking it. You have to make that is a loop, and it should pass through the loop. It should pass through the loop. See, that's a loop, and pass it through the loop. And if you have an assistant, it will be made easier, as assistant will hold the end of the suture material, end of the thread. Even without assistant you can do that. Each time you have to pull it through the loop and then lock it. This is mainly used in long edentulous areas like tuberosities, retromolar areas, and advantage is that this will avoid multiple knot of the interrupted suture and even distribution of tension will be there. Each time you have to pull it through the loop. The procedure is continued until you put the final suture. Continue that until you reach the final suture. Each time needle is reinserted through the underlying surface of the flap and then it is passed through the remaining loop of suture and suture is pulled tightly, thus locking it. Similar to simple continuous suture, the needle should pass perpendicular to the suture line on both sides. And this locking continuous suture is otherwise called blanket sutures. Blanket suture. Then the final suture should tie off at the terminal end. You can continue the procedure, continue the same suture technique until the final suture is reached and then you can tie it off there. This is the final suture. After that we have to tie it, make a square knot, longer end, shorter end, then tie it off. Cut the ends. That is locking continuous suture. So that is a simple continuous suture and that is a locking, continuous suture or blanket sutures.